International research is getting increasingly important. It helps in obtaining results that are more generalizable than findings from single-center or single-country studies. Hi, my name is Philip Mons. I'm professor in healthcare and nursing science at the University of Leuven in Belgium and visiting professor at the University of Gothenburg in Sweden. I'm happy to have the opportunity to present you Approach IS. More specifically, I will address the methods of the project and will discuss challenges and obstacles when conducting international research. Approach IS stands for Assessment of Patterns of Patient-Reported Outcomes in Adults with Congenital Heart Disease International Study. Indeed, the study focuses on health outcomes as experienced and reported by patients. The preparations for the study started in 2012 and the data collection was finished early 2015. Why did we start up this study? Well, when you look at the results of existing studies, you can see that they result in inconsistent findings. And when you compare the different countries where the studies have been done, also here, differences in the results can be observed. The question, however, is if this represents real differences between the countries or if this is because the researchers look differently to the issue. In other words, did they use different methods to investigate the patient-reported outcomes? And if so, then we cannot compare prior studies with each other. Therefore, the goals of Approach IS were first, to investigate what are the differences in patient-reported outcomes of adults with congenital heart disease who are living in different areas of the world. And second, to see how these differences can be understood. To overcome the limitations of prior studies, we used one uniform methodology in all the participating centers. This means that we all looked through the same glasses. Overall, Approach IS was conducted in 24 centers located in 15 countries in 5 continents. On this map, you can see the participating centers and the distribution over the globe. The intention was that we could include 200 adults with congenital heart disease in each center, resulting in an overall sample of 3,500 to 4,000 patients. We used a set of questionnaires in all the different languages of the participating centers. The primary outcome variables were self-reported health, psychosocial functioning, behavioral outcomes, and quality of life. Potentially explanatory variables were sense of coherence, illness perceptions, demographic, and medical variables. Of course, when setting up such an international study with centers all over the globe, one encounters some challenges, but none of them cannot be overcome. The first challenge was to find budgets to cover the costs. In fact, there was no dedicated funding available for this project. From the research budget of my team, we were able to cover some central costs like licensing fees for questionnaires, statistical support, and central coordination of the project. The participating centers needed to find solutions to cover their costs, such as stationery costs, photocopying, postage, and local data management. You can understand that the centers demonstrated great creativity to work around this issue, and they did successfully. Another challenge was to find centers from all over the globe that would be willing to participate. Of course, it is the easiest to look in your own network, but this is limited by definition. In this respect, ISACT, the International Society of Adult Congenital Heart Disease, has been incredibly instrumental in offering a network and a platform to talk about Approach IS and to recruit interested centers. One thing I regret is that when we were setting up the project, we were not able to recruit centers from Africa. Doing an international study like Approach IS means that you need all the questionnaires in different languages. Indeed, we had 12 languages represented in the study. Such a big study cannot be conducted without the involvement of numerous people. And I have to say, it was just fantastic to work with all these people. The challenge, however, was to make sure that all these people were going into the same direction and followed the same processes. For this sake, we have developed standard operating procedures that guided the individual researchers in the participating centers. And not all centers had equal experience in doing research on patient-reported outcomes. So, we needed to be able to support the researchers who felt less certain about their performance in specific aspects of the study. Another challenge was the patient numbers. Some centers would experience difficulties in recruiting the 200 patients as anticipated. It was up to us to see if a lower number of patients from a specific center would or would not jeopardize the validity of the findings. As colleagues, all participating researchers felt utmost committed to the successes of the project, and most of the agreements were kind of gentlemen's agreements. However, some centers needed to have formal contracts between their administration and my university. Hence, we had to develop contracts for this project and to establish processes to have these contracts modifiable to the local requirements and getting all the signatures. At the end of the study, we needed to get all the data from the different centers into one common database. To get the data transferred, we had to develop data entry systems and set up a secure database server. All data provided to the Central Coordination Office needed to be anonymous. And finally, we wanted to make sure that all participating researchers knew and understood that our basic principle was that everyone should benefit from participation in the study. To explicate this, we developed a publication strategy in which it was detailed what processes we would follow to disseminate the findings of the project and regulations about authorship. You see, starting up an international project like Approach IS is associated with a number of challenges. But like I said, nothing that cannot be overcome with a detailed preparation and an accurate follow-up of the study. Thank you.